Drug delivery micelles have been a widely explored topic in the biomedicine chemistry fields. Micelles are composed of a hydrophobic core and a hydrophilic shell. There are many different polymers that are used at the different parts of a micelle. For the hydrophobic core, polymers such as polylactide PLA, polyglycolide PGA, and polycaprolactone PCl are most commonly used. For the hydrophilic shell, polyethylene glycol PEG is the most common. The hydrated PEG shell enables prolonged blood circulation and increased stability for drugs due to PEG's ability to reduce aggregations. The current problem with the pharmaceutical industry and the treatment of cancer patients is the toxicity of anti-cancer drugs. These drugs, although beneficial when it comes to breaking down tumor cells to some extent, often have an effect of harming healthy cells within the body since there has been no definite way of ensuring the acute accumulation of drugs in tumor cells. To attack this problem, there has been a development of targeting in the drug delivery field that aids anti-cancer drugs in accurate accumulation. There are two different types of targeting, active and passive. Active targeting works where micelle carriers connect to specific cell receptors, ensuring accurate drug delivery. The active targeting depends on the use of specific ligands. Targeting units are usually attached to nanocarriers such as peptides, folic acid, and antibodies. Passive targeting is based on the enhanced permeability and retention EPR effect. Passive targeting allows for particles to pass through leaky vasculature in the bloodstream, which only occurs in the tumor site. This leaky vasculature in the bloodstream allows for only micelles of specific sizes to pass through the tumor site, enhancing the accuracy of drug delivery. The impaired lymphatic drainage of this type of targeting prevents the removal of micelles in the tumor site due to the immune system. In order to enable passive targeting, particles of micelles must be between 10 and 100 nanometers. This sizing can be measured with the use of dynamic light scattering, or DLS. Micelles are assemblies of Antiphobic Block copolymers which contain hydrophobic and hydrophilic blocks. One aspect of micellar drug delivery that caught the attention of many is its ability to self-assemble with Antiphobic Block copolymers. However, self-assembly only accurately occurs above critical micelle concentration, CMC, which can be determined by a fluorescence spectrometer. There are a few reasons why micelles are so practical in the medicinal field. Hydrophobic drugs that usually have a difficult time being transported in an aqueous human body are able to be entrapped in the hydrophobic core of micelles. These encapsulated drugs are then able to be transported at concentrations that rise above their natural solubility, improving the accuracy of the drug being delivered due to its prolonged blood circulation life and overall enhancing its bioavailability. Micelle encapsulated drugs are more concentrated in the tumor site than free drugs. Second, the hydrophilic shell can be a great protective shield for the micellar core due to its ability to form hydrogen bonds with the body's aqueous environment. This protective shell prevents the contents of the hydrophobic core from being victims of hydrolysis and enzymatic degradation. The Antiphobic Block copolymers that make up these micelles are created through ring opening polymerization. In one instance, polycaprolactone and ethylene glycol are used together using tin octanoate as a catalyst in order to create the Antiphobic Block copolymer that we want.